The suffix osis denotes an abnormal condition or disease. For example, cirrhosis, a liver disease, or tuberculosis, a bacterial infection. The removal of a body part through surgery is indicated by the suffix ectomy. For example, appendectomy, removal of the appendix, or hysterectomy, removal of the uterus. Breaking down or destruction of cells can be represented by the suffix lysis. For example, hemolysis, destruction of red blood cells, or glycolysis, breakdown of glucose. Abnormal softening of tissue is indicated by the suffix malacia. For example, osteomalacia, abnormal softening of the bones. Abnormal narrowing within the body is referred to by the suffix stenosis. For example, arteriostenosis, narrowing of the arteries. The process of recording, particularly in medical imaging, is denoted by the suffix graphy. For example, radiography, the process of taking X-ray images, or angiography, recording of blood vessels using imaging techniques. Another suffix meaning pertaining to that is frequently used in medical terminology is IC. For example, cardiac, pertaining to the heart, or medic, pertaining to medicine. The procedure involving surgical puncture to remove fluid is known as centesis. For example, amniocentesis, removal of fluid from the amniotic sac, or thoracentesis, removal of fluid from the pleural cavity around the lungs. The prefix neo relates to birth, as seen in terms like neonatal, pertaining to the newborn period. The procedure of visually examining an organ is described by the suffix scopy. For example, endoscopy, visual examination of the inside of a body cavity or organ, or bronchoscopy, visual examination of the airways. The procedure involving surgical puncture to remove fluid is known as centesis. For example, paracentesis, removal of fluid from the abdominal cavity, or arthrocentesis, removal of fluid from a joint. Hypoglycemia refers to low blood sugar levels. It occurs when the glucose level in the blood drops below normal. Symptoms may include shaking, sweating, dizziness, confusion, and in severe cases, loss of consciousness. Hypoglycemia is commonly associated with diabetes, especially when insulin or other diabetes medications cause blood sugar to drop too much. Arthrocentesis is a medical procedure involving the surgical puncture of a joint to remove fluid. It is typically performed to diagnose or treat conditions such as joint inflammation, infection, or to relieve pressure from fluid buildup. Transurethral refers to a procedure or treatment that is performed through the urethra. It is often used in medical terms related to accessing the bladder or prostate, such as transurethral resection of the prostate, TURP, a surgery for prostate enlargement. Hyperemesis refers to excessive vomiting. The term is commonly used in hyperemesis gravidarum, a severe form of nausea and vomiting during pregnancy, which can lead to dehydration and weight loss. Unilateral refers to something that affects or involves one side of the body or a single entity. For example, unilateral pain would refer to pain occurring on one side of the body. Melanoma is a type of skin cancer that develops in the melanocytes, the cells responsible for producing pigment, melanin, in the skin. It is one of the most serious types of skin cancer due to its potential to spread to other parts of the body if not detected early. Cystoscopy is a medical procedure that involves the visual examination of the bladder and the urethra using a specialized instrument called a cystoscope. It is often used to diagnose and treat conditions like bladder infections, tumors, or kidney stones. Leukocyte is another term for a white blood cell. These cells are part of the immune system and help the body fight infections and foreign invaders, such as bacteria, viruses, and other pathogens. There are several types of leukocytes, including neutrophils, lymphocytes, and monocytes. Polycystic refers to a condition characterized by the presence of multiple cysts. It is commonly used in medical terms like polycystic ovary syndrome, PCOS, where multiple cysts form in the ovaries, or polycystic kidney disease, PKD, where multiple cysts grow in the kidneys, potentially leading to kidney dysfunction. Cephalic refers to something related to the head or toward the head. In anatomy, it is often used to describe the position or direction toward the head, as in the cephalic vein, a vein in the arm, or cephalic presentation, when a baby is positioned head first during birth. Colectomy is a surgical procedure involving the removal of all or part of the colon, large intestine. It may be performed to treat conditions like colon cancer, inflammatory bowel disease, such as Crohn's disease or ulcerative colitis or diverticulitis. The extent of the surgery depends on the condition being treated. Asymptomatic refers to a condition or disease that does not show any symptoms. A person with an asymptomatic illness may carry or have the disease but not experience the typical signs or discomfort associated with it. For example, someone can be asymptomatic for COVID-19 but still test positive for the virus. Myalgia refers to muscle pain. It can be caused by a variety of factors, including overuse, injury, infections, or conditions like fibromyalgia. Myalgia can occur in one muscle or multiple muscles throughout the body. Dysuria refers to painful or difficult urination. It is often a symptom of urinary tract infections, UTIs, bladder infections, or other conditions affecting the urinary system. It can cause a burning sensation, discomfort, or pain during urination. Oliguria refers to low urine output, typically defined as producing less than 400 milliliters of urine in a 24-hour period. It can be a sign of dehydration, kidney disease, or urinary tract obstruction. Hepatitis refers to inflammation of the liver, often caused by viral infections, but also by alcohol use, certain medications, or autoimmune diseases. There are several types of viral hepatitis, including hepatitis A, B, C, D, and E, each caused by different viruses and varying in severity. Symptoms may include jaundice, fatigue, abdominal pain, and dark urine. Retrosternal refers to the area behind the sternum, breastbone. It is commonly used to describe pain or discomfort located behind the chest, often associated with conditions like heartburn, gastroesophageal reflux disease, or even heart conditions.